Hello, I'm Richard Diedrichson with the North Carolina Institute for Public Health at the University of North Carolina School of Public Health in Chapel Hill, North Carolina. We appreciate you taking time to join us again. As a member of your own local Board of Health, you, more than most citizens, are aware of the important issues of board governance, general health topics, preparedness, and environmental health as they affect the citizens of your county. You know how your local Board of Health relates to the state environmental health program. You also know how your actions aid your health director in their role as public environmental health advocate. Let's continue our focus today on environmental health. $4.2 to 4.8 million North Carolinians rely daily on groundwater as their source of water. There are currently only 35 out of 100 counties in North Carolina that have their own wells program with local ordinances in place for well construction, repair, and abandonment. The other 65 counties rely on the less stringent state rules to maintain water quality for their citizens' private wells. And still, every day, 83.3 billion gallons of water are pumped from North Carolina ground for our use. Your environmental health specialists use both state and local rules to ensure that your wells are properly permitted and safely sited, that your well construction is inspected, that the water is analyzed for pesticides, petroleum, lead, or other harmful contaminants, and that your private wells are final inspected with negative bacterial results to ensure the safety of your citizens. Here to describe your environmental health specialist role in wells is Ms. Connie Pixley, registered sanitarian from Alamance County.
Well, if you're one of 35 of the local counties that have local rules, you'll hear very few comments or suggestions or problems. But if you're one of the other counties, you may hear a lot of frustrations and a lot of concerns. There are only 35 counties with local well rules, and there are a lot of problems that come up by not having local well rules. If there are no local rules, then there's basically no regulation and little to no education about water quality issues. You'd want to look specifically at local concerns on the coast. The wells are shallow. In the Piedmont, the wells typically go deeper. There are more water quality issues in the Piedmont than the coastal counties. A poorly constructed well, of course, contaminates the groundwater, and so contaminates surrounding wells also. Well, find out if you have local well rules, and if not, adopt local well rules in lieu of there not being a statewide program presently. Adopting the local well rules would give your environmental health specialists the support that they need to go out and protect the water supplies in your county. You also would want to know what the water quality in your county is like. Presently, we send samples to the state lab for analysis, and you would need to find out what the water quality problems and concerns are in your county.
As Ben Franklin said, when the well is dry, we know the worth of water. There's been much written and discussed about the potential for terrorism and the security of small and medium municipal water systems. While the reality of that scenario is still debatable, it is nevertheless true that there are a range of public health emergencies, not just terrorism, that a county may face. Our more common North Carolina public health emergencies have been weather-based. Hurricanes have affected nearly all the state from the coast to the west. Floods have devastated mountain communities. Even ice storms have caused emergency shelters to open. Many of those emergency shelters are opened for you by your environmental health specialists in yet another of their many public health roles. Your environmental health specialists are most likely a key member of your county emergency plans because of the wide range of professional skills they already have. Meet Mr. Troy Dees, Environmental Health Director and Registered Sanitarian in Carteret County, North Carolina, where they and their local Board of Health have faced many public health emergencies.
All counties now, the state has an emergency operation plan, all counties should have an emergency operation plan, and all local health departments should have an emergency operation plan, and you need to know what your role is. It's very important that the locals understand that they must work with other agencies, law enforcement, social services in some cases, and all the agencies involved to provide a quick and proper response that is, you know, there again, protecting public health, because that's what we're all about. What we look for in the Board of Health is support in our actions, support in the training processes, supporting reviewing plans, and understanding what our role is locally, and knowing that sometimes during an event, your local normal workload may suffer because you're doing things out of the ordinary. Just an example, in Carteret County, we've had our share of storms, and after the storms, there has been 2, 3, 4 weeks where we have done nothing but well samples, visiting people in their houses, looking at mold mildew problems, looking at washed out septic tanks, looking at the damage that's been caused. A lot of time it's just sitting there and listening to people and understanding their needs and trying to get that information back to people that can provide some type of assistance. We would like to see the boards of health more involved. We would like them to be you know, reviewing the plans and understanding what the roles of the clinical part of the health department and the environmental health part of it and the public health pest management part of it, because that can play a big role in how we respond and the resources we have to respond. Nowadays, we spend a lot of time in preparation and being ready. We hope it never happens, but we need to be ready in case it does.
Emergency situations challenge the resources of your citizens and your communities. It's great to know that you have such competent environmental health professionals to help you through them safely. Speaking of public health areas that require a broad range of skills, how would you answer these questions? Does your county have a county hospital? Have you passed a tattoo parlor on the way to work? Does your town, hotels, or a local homeowners group own and operate swimming pools? Do you know someone that is in an adult daycare? Is there a prison or jail facility in your area? Are there public, private, or religious schools near you? If you answered yes to any of these questions, then you may already be familiar with yet another area of expertise that your environmental health specialist provides for the county. These are the environmental health responsibilities within the Pools, Tattoos, and Institutions program. When dealing with pools, tattoos, and institutions, your local county can rely on expertise from individuals such as Mr. Brian Ferguson, Regional Environmental Health Specialist.
Well, my position is a Regional Environmental Health Specialist, and I do work with the Swimming Pool, Tattoo, and State Institutions branch. And basically, we're a resource to the County Environmental Health Specialist. We're there to provide education. We also authorize new environmental health specialists in the Swimming Pool and Tattoo program. We're there to offer, I guess, needed education, and also to be a reference point for them when they run into, I guess, sticky situations. We obviously have a lot of tattoo facilities in North Carolina. We have a lot of swimming pools. With the growth we're seeing in North Carolina right now, we have a lot of new construction with subdivisions, apartment complexes, condominiums, things of that nature. We're seeing a really big increase in the number of swimming pools going in North Carolina. And with that, we have a public health dilemma, because with those swimming pools, we have a lot of situations with waterborne diseases. We want to prevent those. And we work with the environmental health specialists of the county to permit, inspect those swimming pools, and to basically safeguard public health. So anything at a hotel, motel, condominium, homeowner subdivision type situation, a fitness club, anywhere where the public can go, get into a swimming pool, hot tub or spa, a wading pool, and even some water features that are found in parks and recreational facilities, we'll regulate those also. The state institutions we regulate at the regional environmental health specialist level are strictly state institutions. So we look at Department of Correction facilities, basically prisons. We also do inspections at state-operated colleges and universities. We also inspect state-run hospitals and any facility that basically is operated by the state that provides room or board. At the county level, the local environmental health specialists will inspect nursing homes, hospitals, other similar type institutions where people are housed and cared for, and food is provided for them. Basically, I get involved in a lot of the gray area interpretation of the rules. The rules are provided from the state, but obviously the county's the one doing the enforcement action. So the local environmental health specialist can call me up, if need be, have me come visit the facility in question to basically clarify the situation and offer, I guess, some of my encompassing view of the situation to share with the environmental health specialist some of my experiences in those areas. Again, the environmental health specialist has to wear a lot of different hats. It's hard for them to be a true expert in all the different areas, and that's where my position comes into play. Well, I would say, for instance, in the swimming pool permitting inspection area, we obviously issue permits to swimming pools once a year. We go out and inspect those swimming pools, and if I were to guesstimate, we would probably do what's called an immediate suspension at about 50% of those swimming pools on their first inspection, which means we would ask them to close until a certain situation that we feel is a very serious situation to public health be rectified. And we obviously need a lot of support when those situations come about. Environmental health specialists at the counties are highly educated. They're very well trained. They have a lot of background that's required for the position, and they're chosen based on their ability to make correct judgments that are logical and well backed. And we would like to have that same backing for the environmental health specialist from the Board of Health. And I feel in a lot of ways my position is similar to what we would want from the Board of Health. We want someone there who's going to reinforce the decision that's made at the county level by the environmental health specialist.
Based on a citizen's concern, all these environmental health areas, plus a familiarity with mold, mildew, and asthma, are skills that your environmental health specialist and you will be able to successfully address together. Lead poisoning is detrimental to the mental and physical development of children. At its highest levels, lead can cause coma, convulsions, and death, while at lower levels it can reduce attention spans and cause reading, learning, and behavioral problems. Young children are most vulnerable and most likely to be playing in contaminated dust and soil. Their symptoms are not always obvious, and it is necessary to do blood tests for confirmation. 20% of North Carolina children under 6 are screened annually. Once identified at elevated levels, your local environmental health specialist assists the certified regional specialist in conducting environmental investigations, remediation enforcement, monitoring inspections, and risk assessments of these children. County registered sanitarians will also oversee sanitation requirements for licensed child care centers and provide consultation to those centers regarding communicable disease control and sanitation in their facility. As a Board of Health member, you may be faced with thorny issues in either of these areas of child health safety. Whether dealing with the emotional issues of a child's daycare or the critical issue of a child's potential poisoning from lead exposure, it's comforting to know that your environmental health specialist can call on the expertise of professionals like Mr. Charles McKenzie, one of 10 regional children's environmental health specialists across North Carolina.
Environmental health specialists conduct routine sanitation inspections. We do outbreak investigations, educational programs for the consultants there and the operators of the child care centers. We're out there in the child care centers as an extra pair of eyes. This is extremely important because, as you well know, once you become involved in a particular activity or process, you lose some perspective as to whether or not that's being done correctly. And we're there to guarantee and to be sure that they do these processes in a manner that they meet our rules. We have a lead poisoning prevention program. It's a state program. The counties are responsible for doing the lead investigations for child care centers and for lead poisoned children who have a confirmed lead level of 20 micrograms per deciliter or higher. The state staff, with the assistance of the county, do the elevated blood lead levels, those levels that from 10 to 19 micrograms per deciliter. Well, lead in house paint, residential use paint, is no longer available. It was discontinued in 1978, but there are still lead in commercial and industrial paints, which hopefully folks don't have access to. But we still have a housing stock that is hundreds of years old in some areas. And this paint was painted on these properties for many, many years, and it still is on the properties, although it may have been painted over by newer paints. The lead-based paint is still there. It's attached to the substrate, the wood siding, or whatever it happens to be. And this deteriorates over time if the property is not well maintained, exposing lead and the paint to hazards. Dust is also a big issue. Windows that have lead-based paint on them generate dust as they're raised and lowered. But generally, flaking, peeling paint around an old property that has not been maintained is what causes our problem with the children. Lead-based paint has a very sweet flavor, and children are attracted to it. What normally happens is the child will see their health care provider. It could be a local health department, it could be a private physician or other clinic. In doing so, at age 1 and 2, it's recommended by the state that they have a blood lead test done. It's a finger prick to determine whether or not they have an elevated blood lead level. All of those are reported to the state. The local health departments and the regional environmental health specialist receive a printout on a monthly basis identifying those children. And then we go from there with the lead investigation. Every daycare center and child care in the state should have by now been investigated for lead poisoning hazards. This was done on properties that are 1978 or older properties. The North Carolina Division of Child Development requests an environmental health specialist to go out and check these on new applicants for child care as well. The regional environmental health specialists in all programs do program evaluations in their particular area of expertise. So we would go into a health department, and in my case I would do a child care program review, for example. We would go out with the individuals doing those inspections and determine whether or not they are proficient in their jobs as inspectors, those types of things. We also look at equipment needs, whether they have adequate equipment, whether or not they need equipment, and what it might be. A report is written and given to the health director. So through that method, we would get the information back to the health director, and in turn he could go to the Board of Health, county commissioners, or whoever might need to help with that budget. Well, the Board of Health can be a great benefit to the environmental health specialist and to their programs. First of all, meeting the needs and requirements that they have for equipment and staffing and things of this nature is very important. We have a lot of counties that are both understaffed. Workloads create stress for these folks, and they tend to leave to go somewhere where they can have a reduced stressful level. The other issues are things like computers, vehicles, things right down to office equipment that these folks need to do their job, and they're not getting them. I know many, many environmental health specialists who purchase their own equipment in a lot of cases. Light meters, for example, thermocouples, those things that every environmental health specialist needs, whether they're doing child care, restaurant inspection, or what it may be.
As a Board of Health member, you may face thorny issues in either of these areas of child health safety from parents and/or their daycare operators. It is good to know that your environmental health specialists are continuing to be well trained as your program and resource person. We've talked about a wide range of environmental health skills that your professional registered sanitarian has. But environmental health is a constantly changing field with new demands challenging both your registered sanitarians and your own Board of Health. For example, the rise of illegal methamphetamine labs has grown exponentially across North Carolina. In 1999, we had 9 meth labs busted in the state. In 2003, we had 177. And as of August 2004, we were already at 207 discovered labs. Effective January 2005, temporary rules were adopted by the North Carolina legislature to increase methamphetamine penalties. They include a provision to adopt cleanup standards for meth lab sites. For every pound of drug produced, 5 to 6 pounds of toxic waste are left over. A meth site cleanup can cost up to $150,000, and your health department, often with the environmental health specialist in a primary role, may be faced with this problem. Let me introduce Mr. Ray Silverthorne, Environmental Health Director and Craven County Environmental Health Specialist, who has been involved in this newest of environmental public health issues.
Actually, it started back in California and those areas a few years back, and moved into the mountains of North Carolina, and now it's moving throughout the whole state. I'm down in the coast, and we had 2 last year, so it is moving throughout the state. They can be found in lots of different places. Anywhere from a tree house to inside of a dwelling to rental units. Even down at the beach, they've had them in timeshare units. We have seen families that are in rental units that have used one area of the house for production of methamphetamine, and they had kids in the house. And what happens then is DSS has to come and take the kids. Daddy's put in jail. Mom, if she wasn't involved, she doesn't know anything about it, then she's left with the cleanup, or actually the homeowner who was renting it to him is left with the cleanup. And it can be a sticky situation. The new rules basically require a pre-treatment assessment, have the area cleaned up, and then a post-treatment assessment. The big concern, I think, is for children that are in these homes that had formerly been methamphetamine labs. They want to make sure that the environment is safe for the children. The children actually have a lot of contact, especially your toddlers that are all down on the rugs and around and everything upholstered. They have their hands on it. The major amount of chemical and all that is gone by the time we come in, but the residual that is left over is what we are trying to make sure that is taken care of. A lot of the environmental health specialists are scared of it because there's a lot of unknowns. Most of the environmental health specialists throughout the state were not formally trained in this area. So yes, there is a very high need for additional training. Taking an active part in the development of the laws is one of the areas that I think the Board of Health could really take an active role in. As always, funding for manpower, for supplies, those things are also an area. But the main thing is learning about what the new rules are so that you can have input into shaping those rules.
Whether your Board of Health is facing a new environmental public health issue, such as meth labs, a revision of on-site sewage rules, a need for a new wells ordinance, or a review of existing permitting policies, it is important for you to consult the expertise of your environmental health specialists as you approach these issues. The skills of these specialists are sharpened yearly by attending workforce development continuing professional education courses, such as those developed and held at sites across the state by the North Carolina Environmental Health State of Practice, or SOP Committee, through the North Carolina Institute for Public Health. North Carolina's registered sanitarians believe completely in their roles and responsibilities, often with a great personal commitment to their community and to their profession. The professional men and women you met here today are typical of the 1,100 to 1,300 environmental health specialists working across North Carolina each and every day to ensure and protect the public's health, safety, and welfare. Until we meet again, thanks for joining us.